who will change the field of medicine. Supported by 310 competent lecturers, including 19 professors in 21 departments and research centers, adequate facilities, and UNS Hospital. The Faculty of Medicine of Universitas Sebelas Maret has been an internationally reputable education institution. Moreover, the facility is equipped with IT facilities and information system that are integrated with the university system, a computer-based test room in a convenient academic atmosphere and green campus, library featuring thousands of books and providing access to a wide variety of international journals, which is expected to enhance the learning of the students, faculty, and researchers. Partnership and strong collaborations have become inseparable parts of our faculty, without which progress in education research and community service wouldn't have been achieved.
Fakultas Kedokteran Universitas 11 Maret merupakan salah satu fakultas kedokteran dengan program studi kedokteran akreditasi A yang berdiri di Surakarta, Jawa Tengah, Indonesia sejak 11 Maret 1976. Sebagai salah satu program studi di Fakultas Kedokteran UNS, program studi kedokteran memiliki visi untuk menjadi institusi pendidikan kedokteran bereputasi internasional, menghasilkan lulusan sarjana kedokteran yang kompeten dan unggul di bidang kedokteran komunitas. Program studi kedokteran juga memiliki beberapa misi seperti menyelenggarakan pendidikan yang berkualitas dan berstandar, riset dan pengabdian masyarakat berbasis iptek kedokteran, serta menyelenggarakan internasionalisasi program studi kedokteran.
Selama lebih dari 44 tahun, FKUNS telah banyak mengalami perubahan, baik dari segi infrastruktur maupun sistem pembelajaran. Hal ini menjadikan program studi kedokteran menjadi program studi berstandar internasional yang mengedepankan budaya luhur bangsa Indonesia.
Pengembangan proses pembelajaran di program studi kedokteran FKUNS berorientasi pada komunitas untuk mencapai profil lulusan yang telah ditetapkan, yaitu sebagai care provider, clinical decision maker, communicator, community leader, manager in health, serta researcher. Sistem pembelajaran Prodi Kedokteran FKUNS mengedepankan pada kompetensi lulusan yang unggul dan berbudi pekerti, serta berdaya saing global. Pembelajaran menggunakan prinsip student-centered learning melalui diskusi, keterampilan klinis, praktik laboratorium, maupun lapangan. Penyusunan kurikulum pendidikan preklinik di Fakultas Kedokteran UNS menggunakan acuan utama kurikulum berbasis kompetensi dengan sistem pembelajaran berbasis masalah atau problem-based learning. Kegiatan pembelajaran diberikan dalam bentuk tutorial, clinical skill learning, kuliah terstruktur, praktikum, field laboratory, serta self-directed learning. Program studi kedokteran FKUNS memiliki beberapa unit kegiatan mahasiswa atau UKM sebagai sarana untuk pengembangan mahasiswa dari segi non-akademis dan mengasah kemampuan soft skill serta leadership. UKM tersebut bergerak dalam berbagai bidang, mulai dari kesenian, penelitian, pertukaran mahasiswa internasional, olahraga, pers, pecinta alam, tim bantuan medis, kerohanian dan keagamaan, serta organisasi kepengurusan Prodi Kedokteran secara internal maupun eksternal.
Dalam 5 tahun terakhir, FKUNS terus terlibat aktif dalam penelitian kolaboratif nasional maupun internasional.
Hal ini menunjukkan bahwa program studi kedokteran FKUNS berkomitmen pada pengembangan ilmu kedokteran dan kesehatan yang tepat guna dan berorientasi pada kesehatan masyarakat dengan selalu mengedepankan pembaharuan teknologi.
Dengan budaya kerja UNS aktif, tenaga pendidik serta mahasiswa FKUNS senantiasa aktif terlibat dalam pembinaan pendidikan kedokteran dan kesehatan, pemberdayaan masyarakat, riset dan peningkatan mutu SDM yang bekerja sama dengan pemerintah daerah serta instansi luar negeri.
Demi mewujudkan iklim akademis yang dapat menunjang kompetensi lulusan, program studi kedokteran FKUNS menyediakan fasilitas pembelajaran seperti ruang tutorial, ruang clinical skills lab, laboratorium terpadu, ruang kuliah, sarana ibadah, sarana olahraga berupa lapangan basket, laboratorium CBT, kamar mandi, aula, tempat parkir yang luas, kantin yang terjaga kebersihannya, ruang UKM yang terawat, perpustakaan, ruang dosen, serta ruang pimpinan dan kaprodi yang semuanya merupakan milik sendiri. Program studi kedokteran FKUNS juga bekerja sama dengan berbagai puskesmas di wilayah Karesidenan Surakarta untuk menunjang pembelajaran field laboratory dan interprofessional education yang menjadi salah satu keunggulan pada program studi kedokteran FKUNS. Dengan komitmen dan integritas serta sistem pendidikan yang berkualitas, program studi kedokteran FKUNS telah menghasilkan lulusan sarjana kedokteran yang berkompeten dan siap menjadi future leader dalam komunitas untuk masa depan Indonesia yang lebih baik. Program studi kedokteran, Fakultas Kedokteran, Universitas 11 Maret, Surakarta.
Selamat siang Bapak Ibu sekalian dan para mahasiswa yang saya banggakan. Welcome to the International Continuing Medical Education Series, INCOME. We have now the second series in the session. We have international education or IPE implementation during pandemic as the topic for the webinar this afternoon. Before we proceed to the webinar, I would like to invite all the participants should be push the mute mode during the webinar. And if you will ask a question, please type into the chat area or comment box later on. The link for a certificate will be shared in the middle of the webinar, including the materials. And we are happy to have 3 excellent speakers in this webinar. We have Professor Marion Huber from Shaw School of Health Professions, Department of International Teaching and Practice from Switzerland. And we have also the second speaker, Dr. Alla El-Awaisi. She is the Assistant Dean for Student Affairs from Qatar University. And the last speaker will be Dr. Daniel Richard Kambey from Medical Education Department in University of Tokyo. We have the changes, including the way we have teaching and learning in the university. And in this webinar, we would like to hear the experiences from the 3 countries regarding the adaptation of interprofessional education curriculum during the pandemic. So we will hear the speech from each speaker for about 25 minutes. But before that, I would like to welcome the Dean of Faculty of Medicine, Universitas Sebelas Maret, or the representative to open this webinar. Thank you.
Thank you very much, Professor Ari Probandari. Has my son heard? Yes. Okay, thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Greeting to all of us and good afternoon, ladies and gentlemen. The honorable speakers of webinar Interprofessional Education Implementation during Pandemic. Here, Professor Marion Huber from Zurich University, Dr. Daniel Richard Kambey, Magister of Medical Education, and Ms. Alla El-Awaisi, Master of Pharmacy, Master of Science from Qatar University. Praise to Allah Subhanahu wa Ta'ala so we can meet virtually in this beautiful occasion through IPE webinar. Also the Honorable Moderator, Professor Natalia Probandari, and the entire committee, especially Medical Education Unit Team Fakultas Kedokteran UNS, and especially the IP webinar participants who are happy and willing to attend this webinar. We know that in this pandemic era, interprofessional education has become a very important element in medical education. This movement encourages Fakultas Kedokteran UNS to develop and implement IP in all aspects of learning. One of them is through this webinar, where we will have discussion based on the experiences of some experts who are very competent in their fields. and hopefully we can reap the benefits and new scientific treasure from this webinar. May Allah subhanahu wa ta'ala always protect us and bestow health blessings on us all in the midst of this pandemic. On behalf of Dean of Medical Faculty, we appreciate this program. And by saying Bismillahirrahmanirrahim, we will open this webinar. And hopefully it will bring many benefits to us. Okay, it is our speaking, and Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Selvi, the Vice Dean for Student Affairs, for opening this webinar. So let's proceed to the main program in this webinar. We will hear the speak from Professor Marion. I would like to invite Prof. Marion to share the screen. Please.
Yes.
Okay. 25 minutes. So screen and time for yours. Thank you.
Thank you very much. Welcome everybody to the webinar, and I'm very honored and pleased to be a part of that and to have the chance to show you a little bit how we manage the interprofessional education during the pandemic time in Switzerland. So I don't know if you know Switzerland a little bit. We are a little country on the European continent, but we doesn't belong to the European Union. So Switzerland is a little bit like a little isle. We are Swiss. We are very intercultural. So this little country has 4 national languages. So it's very difficult to manage in our country all the languages. I think you know it too in Indonesia. For 8 million residents, 4 languages. I think this is a hard thing, but that's Switzerland. So we have a lot of inner borders in our country. I'm located at the Zurich University of Applied Sciences. So this is our new building. And actually in my country, it's winter. We have a lot of snow now. I don't know if there are areas in Indonesia where you know snow. I'm really not sure. I don't know Indonesia. And it would be more pleasant to be in Indonesia now, but it's not possible because of the pandemic situation. So I think we should start, or perhaps to my background. I'm in my first profession, I'm a physiotherapist. Then I go on to complementary medicine, and at least I'm a psychologist, a clinical psychologist, and a neuroscientist. So you see, interprofessional thinking is in my person. I'm the deputy of the the research unit at my place for interprofessionalism, and I'm the no, I'm not the deputy of that. I'm the head of that, and I'm the deputy of our specialist union for interprofessional learning, education, and practice. So perhaps we should think about what interprofessional learning is, or interprofessional collaboration too. So interprofessional learning at our place, we have the understanding that it occurs when we have occasions where members of at minimum 2 different professions learn with, from, and about each other. So our definition is going along with the definition from CAPE, the UK Centre of Advancement of Interprofessional Education. I hope my English is very understandable for you. It's not so good, but I hope if you don't understand something, please ask. I'm not aware of the chat at the moment, but I try to do it in the end. So yeah, this is the definition of interprofessional learning. So how it goes. I think a special environment we have to look about is usually we have a student, a patient, and a clinical educator. I think this is the common and the famous setting of education, of profession-specific education. But if you have interprofessional education, we have more than one profession students. We have also included every time his or her clinical educator, or also profession-specific trainers at university. In the middle, we have the patient. So we in Switzerland, we really are going for a patient-centered approach. So patient is in the middle, patient is a member of our team. So we have to manage it. And so it needs usually a person from outside who is managing all the networking and all the collaboration stuff between all these members of a care team, of an interprofessional care team. And if we want to teach this, we have to manage interprofessional groups. So we are not the clinical educator who are responsible for the profession-specific stuff. We are responsible for the overall stuff, bringing all the professions together, learning them how I have to communicate, how I have to behave with other professions. So this is our basic idea from about interprofessional learning. Yeah, it works. So we have in the area of Zurich, so it's more or less in the center of Switzerland, not really, but it's in the German-spoken part of Switzerland. We have a lot of interprofessional activities, and I'm so sorry, this map is just existing in German, but you see all the gray fields are interprofessional activities. The arrows are showing which institutions are working together. So there is a lot of interprofessional activity in Switzerland all over. It's like the same, like this map. I only can speak for Zurich, for the area of Zurich. And when we speak about interprofessional collaboration in Switzerland, I think it's not something else than the education. So at minimum, two different professions has to work together to reach a common goal. And the important thing in this sentence is to reach a common goal. So it's not a goal which is defined by one person, like the physician or something like that. It's the goal we set together, and that needs communication. It's also a negotiation regarding the roles we have. So we have to negotiate every time who is responsible for what, who is in the lead in a specific situation. Then it's possible to reach the common goal. So it's linked to the definition of Zwanstein. But this definition I like especially because it includes really the problem areas we have in interprofessional education, also in collaboration. So we have power imbalances. I'm not sure how the rights or the laws are in Indonesia, but in Switzerland, the physician is the at the end is the responsible person, and he has the rights to sign. So we have the power imbalances, and we have to manage them. We have a lot of communication problems. This is resulting out of our professional or building the professional identity. Professional identity makes that we learn an own language. So we have nursing language, we have medicine, physician language, we have physio language, occupational therapist language. All these languages has to come together, and we have to develop a common understanding of all the included languages. So to reduce misunderstandings we every time have in the clinical environment, also the overlaps in the handling, in the managing, in the patient management. We have a big overlap when we are treating the patients, and we have to negotiate who is doing what, when. And so to reduce conflicts, we all have all the time. So this is the reason why we are going with this definition in Switzerland, more or less the whole Switzerland. And the difficulty we have, I think you have too, it's the same all over the world. We have to learn as educators, we have to learn our students how to negotiate, how to identify conflicts, how to solve conflicts, and how to handle powerful situations, and clarifying the roles. That interprofessional collaboration can be or can work. My place is the largest University of Applied Sciences with 8 departments in Switzerland. The Department of Health is the largest of about 10 health profession schools all over Switzerland. So per study year, we have around about 415 to 500 students over all professions. Actually, we have 5 different professions. So we have the physiotherapy, health professions, nurses, OT, occupational therapists, and the midwives. Oh, I'm really sorry, I forgot the midwives here. The medical school, we only have a cooperation. We don't educate physicians at our place. It's only in cooperation for the interprofessional part or the interprofessional education program. We are very happy to have a specialist office for interprofessional teaching, practice, and research. I think it's not so common to have something. So we have a big team who is managing the interprofessional program at my place. We have collaboration with all profession-specific programs. So my team, the interprofessional teacher trainer team, has a very strong collaboration and cooperation and integration of all our programs. So we integrate all, or not all, but a lot of the profession-specific teachers. And this is one of the problems because they have their professional identity. They don't have an interprofessional identity. So we have to train them to teach interprofessional student groups at university and in the hospitals. So we have, I just said, our programs we just have at my place, and I think it's also a special point that we have 30 credit points for interprofessional education over the 3 years. So it's a big program in the bachelor degree. So it's bachelor degree. The main subjects, so it's longitudinal education. We have the main subject is communication, including conflict management and managing powerful or hierarchical structures. And on the other hand, we have the research methods, qualitative, quantitative, and how to write a bachelor thesis, all that stuff. So these are the main topics of the interprofessional program. We also have health economics and health justice. So it's I think, yeah, a lot of different subjects which are included in these 2 pathways, or into the 30 credit points for the bachelor degree. At our place, all students have to participate in the interprofessional program, so they have to reach the 30 credit points. And additionally, we have in the area of Zurich, we have the first interprofessional clinical training ward at the University Hospital of Zurich. So it's an interprofessional practical educational environment. So it exists since 3 years now, but not every student is going through that. So we don't have the capacity for the moment that every student can join the clinical training ward. We have, if we're talking about managing during pandemic situation, I think we have also to think about competences. So we believe that we have 3 different kinds of competences. So you have the profession-specific ones. You have the common competencies. Sorry, there's a writing mistake. And we have also interprofessional competencies and skills. And this is the German word. I'm so sorry. It was night when I prepared this talk. Please excuse some mistakes in the slides. We developed a set of competencies. So it's a competence framework. It's just existing in German. I have to translate it. So time is running. So we didn't have the time till now. I think it's not that the competencies are completely different from each other. So they are working together and they have to build up together. So this is our belief that we start with interprofessional education in the first semester and we end in the last semester at the end of the education program. So this is only a picture how we are doing it. So here you see all the semesters. So we have usually a 3 or 4 year bachelor programs. The 4th year usually is mostly a practical year. So the students are in the clinical field, but the first 3 years they are also at the university. So we're starting in the first semester, especially with the research methods, and we start with qualitative methods, and we want to have a deep discussion about research methods or approaches which are used in different professions. So I think it's not so common to teach scientific stuff or scientific subjects as an interprofessional one. So it's commonly multi-professional, but we try to focus on the interprofessional part of that. We have a lot of interprofessional competency election offers. So here they can choose between 20 different topics or subjects, and here also in the 6th semester. And we also have the communication, which we started in the 2nd semester. This because they need a little bit of professional identity at first, a little bit interprofessional identity to start with the conflict situations and all that. The lockdown was a very, very big challenge for us. So it was March 2020 in Switzerland. So the whole skills training was stopped, and it was postponed into the summer months during the vacation time. So it was a challenge to deal with the students, to give their vacations for doing all the skill stuff. It wasn't sure if we could do it because we didn't know how long the restrictions will go on in Switzerland. So it was a hope that we can do it in the vacation, and we could do it in the vacation over summertime. So it was July, August, and the beginning of September where we did all the skill stuff as block courses. Usually they have weekly their skills training, but in the situation of COVID, we changed to block courses during the summer vacation time. All other classes were held online. So we just had a break from 1 week. And in this 1 week, so the students have had 1 week off, and all the educators had to transfer the physical lessons, lectures onto online programs. It was very, very difficult because the most of our educators aren't really experienced with e-didactic, because in Switzerland we like to do physical education, so face-to-face education, and being in the classroom physically. And so for us it was really a big challenge to put all our stuff in 1 week into online programs. It was I think it was a sleepless week in Switzerland on the high school. So yeah, but it works. I can't say that it was really a good e-didactic, because the most of the colleagues transferred their PowerPoints and bespoke their PowerPoints and put it on our Moodle platform. I don't know which e-didactic platform you are using. We are using Moodle, and Moodle is, it gives us a lot of possibilities to make a good e-didactic. So our teachers had to learn e-didactics in very short time. There was a big anxiety, not being successful with that. And so in the start, the e-didactic, it was a horrible trip. Sometimes we had synchronous lectures. So from, like I'm doing now, like a live talk, this was the best one. But bespoken PowerPoints, our students, at the end of the semester, our students, the feedback of our students was, please, not anymore a bespoken PowerPoint. So they would like to have a little bit more differences and different methods, e-didactic methods. So we try to do it in this time. So the problem at our place is, I don't know how it's at your place. Usually in the program, in the IPE program, we have all students to the same time. So it's a management of about 500 students for one class. And it's also very difficult because we have included about 30 to 40 different educators in one module. So we usually our modules are start with a lecture like I'm doing now, and then we have seminars, and in the research part we also have tutorings. This is more or less student by student and supervised by educators. So we have to change all that into online e-didactic. It's challenges, I just said. The problem was that there was really a little knowledge about the e-didactic methods on the part of the trainers. So how we can manage it in 1 week, this was really difficult. So we established an IP e-didactic specialist group for supporting all the teachers and for doing better e-didactic lessons than only bespoke PowerPoint presentations. And we also, and this was a very clever part of the change, we also involved the students very strong to ask how you want to have the lessons, in which kind of e-didactic you want to have the stuff. And this was very good discussion because the students had really cool and very, very good ideas. So we have a lot of different e-didactic methods. So webinar, I think you know that best, webcast also, but we defined it for our place. And so we tried to manage also the skills training with e-didactic parts, and it works. So we have a lot of live interaction parts done. So the students have to present some skills from their home, and we give feedback. There were a lot of web consulting one by one for the skills, especially. We have parts with actors. They play, or they starting playing a role play with the actors. So I think it was very challenging, but it was very funful. So it's the rest, I think you know. We defined for us different kinds of e-didactic methods to match the stuff or the subject and the e-didactic method. The special online offer we had was the role plays. So it's like you hear an orchestra training. Each person is at his home, but the actors played a role play. Also, our students had to play a role play, but each person was at his home. This was really challenging, but it works. So this was a special offer. And also the same we did in the online lessons for communication skills. So we use Zoom or MS Teams. I don't know if you, yes, Zoom we are now, but I don't know if you know MS Teams. So we have the channels from MS Team, and you can make video chats like with Zoom. Yes, so it was a very interesting experience. We just want to keep that, or part of that, because the focus, if you're at home and if you have to see to the colleagues only virtually, it's more focused. We realized after doing these special offers. So all 5 steps our educators did the last half year. So it's a fast time. Now we have a lot of educators who are willed to work with e-didactic. And at our place, so I think it's the same in Indonesia, costs is every time a big topic in each university, and also at our place, knowing that we are very pleased with a lot of money regarding or in relation to other countries. But so the cost effectiveness of e-learning, there isn't an effectiveness because it needs a lot of support. But the students like to be flexible, and the student feedback was, I like to be at home to learning, not every time, but a little bit more than I was able to do it in the past. So we will take some lessons learned out of the pandemic situation. Actually, this is the current situation. The skills training takes place every time at university or at the hospital. So we have the rules, we have the restrictions, but now we are saying, so we educate health professions. So in the clinical part, they have to work, so we can do the clinical skills training. The interprofessional clinical training ward was running. It just stopped last week. The rest of the lessons will remain until summer online. So I think, yeah, it's still a lot of e-didactic we are doing all the day. Now we are starting a training program for our teachers for e-didactic. So the special IP team is doing it, because managing 500 students to the same time online, it's not so easy. You have to learn all the different possibilities you have to work in groups, to bring them again together back. So it's for all that, we started a training program, and we established a fixed group of students who support the ideas, transferring the stuff they have to learn onto online and e-didactic tools. So, and this is a very, very good group of students. They are very creative. And so I think in future, and it starts now since about 2 months, we have very interesting e-learning programs. And there's a new effect. It's a stronger cooperation in Switzerland between all our health profession schools, also the schools of medicine, because we thought we can share some courses, and this is new in Switzerland. It's very difficult to share something over the language barriers we have. But now we are sharing, now we are closing together for developing IPE education, and also profession-specific education. This was the only literature I referred to. Oh no, I forgot Schwarenstein. I'm so sorry. And now you have a really great picture from Switzerland. And thank you for the attention.
Thank you, Prof. Marion.
I hope I was at time. I'm not sure.
It's okay. Yeah. Thank you, Prof. Marion, for giving the speech for us. Let me just summary in brief that Prof. Marion explained about the implementation of IPE in Zurich University. So the focus of the IPE program in Zurich University is mainly teaching the the communication skill, as well as how to manage the conflicts among the professions. So it's implemented in both bachelor degrees as well as in professional rotation. And we learned also that in Zurich University, they adapt the situation, in the curriculum of IPE from the face-to-face meeting to online learning, and they create e-didactic specialist groups that help the teachers to learn as well as to implement many types of modalities in learning to facilitate the IPE learning for the students. So thank you, Prof. Marion, for that. And the next speaker will be Dr. Alla from Qatar University. Dr. Alla is the Assistant Dean for Student Affairs, and she's also a leader and active researcher in IPE since 2014. So please, Dr. Alla, you can deliver your speech about 25 minutes. Thank you.
Okay, can you
please unmute? Yes, unmute, please.
unmute?
Yeah.
Okay, can you hear me?
Yes, perfect. Thank you.
Yeah. Okay, thank you all so much. This is Alla from Qatar University. I chair the QU, the Interprofessional program at Qatar University, and I'm also the chair of the next Altogether Better Health conference. Okay, yeah. And I'm a pharmacist by background, just to let you know. So I would like to thank you for inviting me to be part of the interprofessional education implementation during the pandemic, and to share with you our experiences of delivering this IPE before and after the pandemic. I was in Indonesia I was just trying to remember, back in 2017, October 2017, when we were able to travel. Hopefully, you know, we will be able to do this again soon. So it was really a nice conference. I met many lovely people there. And it was really great seeing how people are really exploring IPE, trying to integrate it. And I think one of the really interesting things I saw, there were many people from the practice, coming and attending, wanting to really learn about IPE. So this was in Sorokatra. And now we're having this over Zoom. So this is with what we say, global connection made easy. Just as Professor Marion mentioned earlier regarding IPE, I'll just maybe reiterate the definition by CAPE, and this is what we tend to think about when we are trying to design any IPE activities, that IPE is when we have two or more professions, they're learning from each other, learning with each other, and learning about each other to improve collaboration and the quality of care. And as you know, and I'm sure many of you are familiar with, back in 2010, they had the framework for action on interprofessional education and collaborative practice. And I think one of the key messages from this framework is, if we are expecting healthcare students, once they graduate, that they will be working together as a team, why are we not giving them opportunities within their education to learn with, from, and about each other? So within this framework, hopefully with giving students the opportunity and integrating IPE within their curricula, by the time they graduate, their collaborative practice-ready health workforce, and these health workforce will be promoting and practicing the collaborative practice, which will enhance health services provided. And I have here the quote is, by failing to prepare, you are really preparing to fail. So we need to succeed to prepare So we are preparing to succeed. So the IPE journey in Qatar, I don't know if any of you have been in Qatar. It's Qatar within the Middle East. It's within the Gulf region. If I go back to how we started IPE, it started, I would say, back in 2009. When the Qatar Interprofessional Health Council was formed to drive IPE forward in Qatar and in the region. And then many of maybe the leaders within this council left Qatar, and I would say the council became dormant. And I think, this is one of the important things is when we are trying to initiate any IPE initiatives, we really need to be thinking about sustainability. However, it was, I would say IPE was sustained in it did continue in the country with the establishment of the Interprofessional Education Committee, which was led by Qatar University College of Pharmacy back in April 2014. And the reason the College of Pharmacy took the lead to start with is because it's the College of Pharmacy, they have the Canadian accreditation. So as part of the Canadian accreditation, they needed to show evidence that they have IPE integrated within their curricula. So I think that was a really good starting point, when we talk about sometimes accreditation really driving the integration of IPE into the healthcare curricula. And then in 2017, we had established within Qatar University QU Health, which is an umbrella of all the QU Health colleges in Qatar University. So the committee moved from a college level to a QU Health level, which was really important to try to formalize a lot of the IPE activities that we do and advance it further. We have representatives within our IPEC, that's our IPE committee. From Qatar University, there are four healthcare colleges, Pharmacy, College of Health Sciences, and College of Medicine, and the new College of Dental Medicine. Plus, we have representatives from Weill Cornell Medicine and College of North Atlantic, where they have some health sciences program, and College of or University of Calgary, Qatar, and that's where they teach the nursing program. So we have representatives within our committee within Qatar University and outside Qatar University as well. So IPEC responsibility, or our main roles, were to provide guidance and support in implementing and integrating IPE within all the different healthcare curricula at QU Health and other healthcare programs in Qatar to improve healthcare system and patient care in advance of their careers, and also to try to, work together to design and implement and evaluate IPE initiatives and promote awareness for IPE and interprofessional collaboration in Qatar and the Middle East. So the IPE focus, we have four main focus. It's on the curriculum, faculty development, student-led initiative, and research. And as you know, there are many different IPE shared competencies. And the council that kicked off the IPE in Qatar developed the IPE or shared competencies for within the Qatar context, which are quite similar to the Canadian and to the North Americans' competencies. However, when we are designing any IPE, we make sure that these are the basis of any IPE event. So this is role clarification, interprofessional communication, shared decision-making, and patient and family-centered care. And this is the model that we adopted. So within the first couple of years, the students are exposed to the concept of IPE. Then they are immersed. And hopefully by the time they graduate or post-graduation, they have mastered and are able to practice what they have learned. And this is in a summary what we do. So within the first year, we introduce the student to the concept of IPE, and then in the second year, it's more about trying to, interprofessionally communicate with each other and clarify some of the roles. And then in the third year, it gets more clinical, where we have a case on diabetes and another one on pneumonia and antibiotic stewardship. And then we do include it within their last years, within their clinical placement, and we have a simulation activity as well. We have the IPE Student Association, who are quite active, and they do an annual IPE forum. So this is, it's like an extracurricular activity where the student, they may come and present their researches, they come and present their, come and share an IPE experience, talk about their profession, their roles, and we have different workshops that happen. And in the last 2 years, we've introduced the Healthcare Team Challenge. Now, the 5th IPE annual for healthcare student happened on the 29th of March, and our classes were suspended on the 11th of March. So this was just about a week before the suspension of classes due to the COVID-19. And for the Healthcare Team Challenge, we included, it was actually on the it was a COVID-19 case where it was very interesting presentation. Students, presented their care plans, and it was really well received by the audience and the students themselves. Also, our students, they've done outreach activities. One, we had it on smoking cessation. So as a team, healthcare team, they go out and they reach for the public to educate them about different topics. Another one we had on hypertension. So this one was, is your blood pressure? Let's keep it under control with the healthcare team. And we've been publishing about our experiences. I remember when we started, there was really hardly any publication on the topic, and now we've got around 30 or over publications on IPE research in Qatar and in the Middle East. In terms of faculty development, we started with a symposia trying to equip faculty member with the knowledge to develop IPE content, which I think is very important. Faculty development is very important because if the faculty is not really well trained and they don't understand the skills, like I could be a really good pharmacy facilitator, but that doesn't mean I can, be a good IPE facilitator. So training is very much needed. We also hosted the first Middle East conference that was back in 2015. And it was really well received. We had Professor Hugh Barr, IPE experts from the UK and Canada. Also, we've done some CPD events as well. So these are continuing professional education to practitioners, to try to how to translate this interprofessional learning into collaborative practice. And we are an emerging network within the Interprofessional.global, which is the global confederation for interprofessional education and collaborative practice. So when the COVID-19 response or when the COVID-19 happened, I think one of the first things that we've done, as I said, we had the Healthcare Team Challenge, where our students were given a case about a patient who had contracted COVID-19, and how will the patient deal, how the students as healthcare students will deal with the case. Also, we have hosted a series during the summer. As you know, like the disruption was very inconvenient, like caused a lot of inconvenience and a lot of disruption within our educational system. And, I think it was quite challenging for the different profession to try, how are we going to deal with our own profession, the outcome needed for our own profession. So the summer break was, especially as many people did not travel, or everyone did not travel. So students took it as an opportunity to do IPE virtual debates. So we had a COVID-19 series. As you can see, we had like the positive team, the negative team, and these were interprofessional teams. We actually were planning just to have one, but however, there was a lot of interest from the student that we ended up with 3. So the first one was looking at whether considering the continuous quarantine and precautionary measure should be a priority over lifting the restriction to avoid the negative economic and social consequences. And the second one was on that this House believes that in public health emergencies, the necessity to protect the public should outweigh personal freedom. And the third one was regarding telehealth, which was very important, and whether telehealth can provide patients with more cost-effective and better care than the current practice. And we have an upcoming virtual debate, which I invite you to all watch. Actually, for these debates, if you would like to watch them, they are on the Qatar University YouTube channel. So you can, they are available for the public to see. So we have this one coming up. This is one between Qatar and the UK. So we will have UK student versus Qatar healthcare student. And the motion is this House believes that government should make COVID-19 vaccine mandatory, which I think is a very interesting and a hot topic at the moment. This is scheduled on January 13th, 2021. And again, this is going to be open for the public. I'm happy to share with you the information regarding this. And you're more than welcome to watch it. Now, the other challenge was, turning our IPE into virtual events, especially as everybody was, everything was turned into online. So we had the IPE smoking cessation and the case-based IPE diabetes. And the way that we've done them, we used Teams and WebEx. So for the first one, we had the students were divided into small groups with a facilitator, and they went through the case. With the smoking cessation, the students then came back to the large team to feedback what they have learned. With the second one, the diabetes, the students were given the case and they worked with the facilitators. And one of the things that we use is the Google Jamboards. And these are usually we tend to use a lot of flip charts within our IPE activities where students can, draw and, sometimes do their presentation on it. So we use these, and this is just an example of some of, how students, they were interacting, actively engaged within within the Jamboards. And everyone was contributing to the case, trying to answer the case question. And in the second image is some of the feedback the student had. And it worked well. I think with IPE activities, definitely students prefer having face-to-face, but they have enjoyed doing these activities. And I think a lot of us had to resort to some measures to continue what we are doing, because not because we are in an emergency, IPE is no longer important. It is important, and we needed to continue doing this. I think just overall, the interprofessional collaboration or this COVID pandemic has really necessitated a lot of interprofessional and collaborative practice at many levels, and many has been learned from the process. And I think if you think about on how this reflects on your experiences, many teams came together, and I think I attended recently a CAPE symposium, and it was whether COVID-19 was a gift or was it a challenge. I think, yes, it was a challenge, but again, it was really an opportunity to bring people together. And the Journal for Interprofessional Care had a special edition on COVID-19, and Dr. Andreas, in his editorial, he was saying the pandemic led to a renewed focus on interprofessionalism, which is welcomed by many. However, for some, this may also surface reservation and anxiety engendering tribalism, which I think is really very true. And I would invite you to read this special edition, and it has a lot of really some interesting experiences on how people dealt with the COVID-19 and considered the interprofessional working within it. Myself, with Dr. Veronica and the Professor Marion, we did a content analysis, and that was an article that we had looking on perception of who is in the healthcare team, a content analysis of social media posts during the COVID-19 pandemic. And this actually came from, I posted on my Twitter account this image on who society thinks works on the hospital versus who actually work in the hospital. And I was amazed by how many people retweeted and liked it. And this image was used by many, and it was just amazing how much people really they really were engaged within this post. So within the CAPE research team, like I was fortunate to work with Dr. Veronica and Professor Marion and two of our students to just try to understand, what people really like, why people really related a lot to this. And quickly in a summary, I think, people were very, there was this sense of relief to see this, and the word hero was commonly used. Many people were feeling thankful to see this post and acknowledging that there are many professionals who are working for the safety of the patient, but at the same time more than half had this sense of frustration on that media portrays healthcare teams as doctors and nurses, and many felt that their jobs are really overlooked. And when we looked at when we did the content analysis, there was one of the main themes was on perception of who is in the team. Many healthcare professionals are on the front line. It's not just doctors and nurses. There was agreement, and some people felt, or some of the professions felt excluded, that we are feeling invisible. We don't get enough credit. No one really remembers us. Actually, from looking at this, there were many people who were saying, oh, we should be on this list, we should be on this list. So when we counted just for the period that we did the content analysis, 48 healthcare professionals, felt, oh, we were not added here, 65 non-healthcare professionals, and there were 13 that overlapped between the two professions. So one of the key messages from this is that the COVID-19 pandemic has highlighted that along with physicians and nurses, other professional staff have really significant patient role, and that the current COVID-19 pandemic and the media attention should really be taken as an opportunity by the interprofessional community to really work together to promote the interprofessional teams and combat these negative media stereotypes. And I think one of the things we definitely identified that there is really a need to try to increase understanding of public perception of interprofessional practices. And the last thing I want to touch on, sorry, I don't want to go beyond time, is, as you know, we have the Altogether Better Health Conference. If you may, some of you may know that Interprofessional.global, which oversees the Altogether Better Health, it started back in 2004. And then with the formalization of the Confederation in 2018 in Auckland, there is, these are the different networks that exist here. And the Altogether Better Health, it's like the big IPE conference under the direction of Interprofessional.global, and it happens every 2 years. We were meant to be hosting this conference in October 2020. So that would have been the 10th anniversary for the conference. As you see, these were the countries that hosted the conference. And the theme of our conference is cultivating a collaborative culture, sharing pearls of wisdom, where we are, wanting people from around the world to come and share their experiences. And these were our sub-themes: advocating for people-centered care, health and well-being, embracing diversity of stakeholders, informing regional and global IPE policies and standards, promoting safety in and beyond healthcare setting, and sharing the best models of practices. The new date is between the 22nd to the 25th of October 2021 and within Qatar. So hopefully things will go well and we will be able to host this face to face. And I really would encourage you, to consider sharing your new pearls of wisdom that may have been cultivated during this pandemic. Yes. Unfortunately, as I said, due to the coronavirus, this was postponed. So we say in Arabic, ahlan wa sahlan. So really we hope to welcome you in Qatar in 2020. These are my contact details, my Twitter, my LinkedIn, and I would be more than happy, to answer any questions that you may have. And really thank you for giving me the opportunity to come. It feels like a race, there is a lot to talk about. I think when it comes to IPE, we can take ages to talk about IPE because it's something that's really close to our hearts. So thank you very much, and I'm looking forward to the rest of this webinar.
Thank you, Dr. Alla, for very interesting speech. Let me also summary in brief that we learned from Qatar University about the model of IPE that has been implemented. And then we learn as well the things of the way of IPE learning from face-to-face and outreach activity into full online activity. There's also an interesting virtual debates. I'm thinking maybe it is good as well to have Indonesian and Qatar forum in that debate. Ya. Oke, Bapak Ibu sekalian, sebelum ke pembicara selanjutnya, ini secara singkat tadi ya, kita sudah mendengarkan dari Prof Marion dan Dr. Alla tentang implementasi IPE di Switzerland dan di Qatar. Kalau ada hal-hal yang perlu ditanyakan silahkan untuk chat ya, dalam bahasa Indonesia juga nggak apa-apa, nanti akan saya bantu untuk sampaikan. Okay, so let's have the last speaker in this webinar, Dr. Daniel. Dr. Daniel Kambey is now a PhD medical education student in University of Tokyo. Dr. Daniel pernah ya ke Solo ya, saya kelihatannya beberapa tahun yang lalu. So several years before, Dr. Daniel has attend our forum, international conference in Universitas Sebelas Maret. We are keen to learn about the experience from University of Tokyo on interprofessional education and collaboration practice, and then how it is implemented during the COVID-19 pandemic. So time is yours, please.
Okay, thank you. Check. Can everybody hear me? Yes, I hope so. Thank you, Prof. Ari, for introducing me. My name is Daniel Richard Kambey. I'm from Indonesia actually, but now is currently studying in Japan. And thank you for Dr. Eti, Dr. Boy, dan Dr. Bulan for inviting me to speak in this ONS event. I was asked to deliver a lessons learned in COVID-19 pandemic from Asia Pacific perspectives. Okay, there are three topics that I will talk about today. The first one is introducing me, myself, and my organizations. One is AFAMEE and APIPECNet, and also Interprofessional.global that Alla already talked a little bit about before. And the second one is lessons learned from COVID-19 pandemic. And the third one is suggested way forward in how to implement IPE. Okay, the first one is introduction to IYHPS, APIPECNet, and Interprofessional.global. IYHPS is a young health professional organization from various health education background who have the spirit to contribute in improving health quality in Indonesia through health education program based on interprofessional collaboration. We are a non-governmental organization, non-profit and neutral. And IYHPS stands for Indonesian Young Health Professional Society. And the next one is APIPECNet. As you might know, there are several IPE networks globally, and in the region of Asia Pacific, we actually established the Asia Pacific Interprofessional Education and Collaboration Network in Surakarta. So we did it in Solo in 2017, the event that Prof. Ari talked about a little bit earlier. And it covers pretty much the eastern part of Asia, from Indonesia up to Japan, up to Mongolia. And this is from the time of the first APIPEC conference in Surakarta, in Solo. Actually, we already have the second one. The second one was done in Manila, Philippines, this year, January this year, before the pandemic started. So we did the second APIPEC conference in Manila, and hopefully in 2022, we will do it again in Malaysia, in University of Newcastle, Malaysia. Okay, what is APIPECNet? Asia Pacific Interprofessional Education Collaboration Network and Collaboration Network is a platform to connect local champions of IPEC in Asia Pacific to work collaboratively. The current condition based on our encounter are in IP are existed in Indonesia, Japan, Hong Kong, Singapore, Malaysia, Philippines, Thailand, Laos, Nepal, Mongolia, South Korea, and Vietnam, and maybe more. We want to connect these local champions to connect with the other IP actors globally. Currently, still as a special interest group without any structure, at least until the third APIPEC conference. And also, we have a collaborative program development and collaborative research plan in the next 3 years. Start with who doing what to what extent, and I will talk about it a little bit later in the end of my presentation. This is the dream of IYHPS that was told to me in 2015, actually. We want to have Indonesian IP and CP Center, which covers the program development of IPE, research development, capacity building, and driving innovation in community. And actually, Dr. Boy and Dr. Eti also have been involved in writing the naskah academic and the academic script and the academic paper and the curriculum framework of IPE in Indonesia, but it haven't been officialized yet by the dictee. So we're waiting for it. Hopefully hopefully in 2021, when we do another event, hopefully with our partners globally. So I will introduce to you the Interprofessional.global. Before we talk about Alla talk about it a little bit. Interprofessional.global is a global confederation for interprofessional education and collaborative practice. Who are we? Interprofessional.global facilitates support and exchange between the interprofessional education and collaborative practice. Networks establish relationship with other like-minded organizations and welcome and support new networks sharing the same aim and values. It also select institutions to host future altogether better health conferences. And the next one will be like Alla has shared before in Qatar in 2021. I'm looking forward to meeting maybe some of you there overseeing the work of local planning committees, maintenance of standard, and evaluation. This is the vision, mission, and objective of the organization. You can find it in the website. The website actually is Interprofessional.global. So we use the same name for our domain. And the important part is there are several working groups. The current working groups and the lead facilitator of each group are academic and workforce development, communication by Richard Pitt from UK, academic and workforce development by Siraj Ali Mohammed from India, data repository by John Gilbert from Canada, finance and funding system and funding by Stephanus Neiman from South Africa, partnership facilitation is by Johanna Dahlberg from Sweden, policy development by Jose Rodriguez in US and Barbara Maxwell also in US, and also global situational analysis by me and Hossein Khalili from Canada, currently in US. The outcome is an update for the Sydney Interprofessional Declaration that has been released in ATBH 5 in Sydney 2006, if I'm not mistaken, and an update of this frequently referred document by WHO, the Framework for Action on Interprofessional Education and Collaborative Practice. Okay, now we move on from lessons learned from COVID-19 pandemic in Asia-Pacific perspectives. So COVID-19 pandemic impact COVID-19 has restricted the face-to-face meeting of universities. Basically, universities don't have any students attend physically. Most of them, I know some in US already started physical classes, but most globally still do an online learning. COVID-19 restriction necessitated whole-scale conversion of curricula to online learning environment globally. Now moving to online environment, it's the best we have for now. The problem is what kind of online learning we want to adapt. Is it the synchronous one or is it the asynchronous one? Both have its own merit and its own downside. What are the content? What are the content we want to put? Like Marion has said before, like Prof. Marion has said before, that there are people who literally put their slides online and that's it. Until now, from my observation, until now we rely heavily on face-to-face group works and community visits, and can both effectively delivered online. That's some problem that I know many of the IP actors across the globe, especially in Indonesia, also has the problem on what should we do with this? What can we do? The first one is the online learning methods. The online learning method is we can do the online group works. Can it be done? Yes, it can be done. Is it easy to do? No, it's not easy to do. What needs to be done? What needs to be done is we're not just moving the discussion online. We usually thought that, okay, we will move to online learning and just move the discussion and all of the other substance online, so people can access it online with synchronous online learning. It's not just that. We have to deconstruct the face-to-face methods, take the important learning objective, and reconstruct the methods to fit online learning environment, whatever the chosen platform is. If I'm not mistaken, ONS has Moodle and Google Classroom, if I'm not mistaken. Please correct me if I'm wrong. And from there, you can reconstruct the method to fit the learning environment. How do you do it? Prof. Marion has said some interesting idea that I also agree on. Please involve students in making in building or developing your own IPE course, online IPE course. The second one is online community visit. Can it be done? Yes, it can be done. It's not easy, and please consider the restriction in the community. In Japan, it can be done because most of the patient can have like online connection, if not by themselves, by the what do we call it in English, like the social home staff that will help you to connect with the students and all the health professionals. I don't know if it's possible in Indonesia. Maybe some areas are possible, but if it's in the some limited areas, it might not be possible. So other means of communication might be necessary, like only using WhatsApp group or only using Line group or by phone is necessary, but it can be done. It's not easy, but it can be done. And what is the important point to make on the online community visit is the facilitator need to take time to debrief and emphasize on the interprofessional values achieved in the session. Usually we send the students, they go to the community, to the patient's house, and then they just do whatever they have to do there. It's like they take examination, they take the history of the family, and they try to create the intervention there. But we need to remember that those are the vehicle. We need to take time to debrief and emphasize what do they learn, not just they go there and do something, but why are they doing it? What are the communication skills that they need to have in delivering collaborative care? What are the conflict resolution skills? How conflict resolution works between health professions in the field? That's the thing that need to be debriefed in the online community visits. The suggested way forward for me is the first point. I have 3 points. The first one is to exploit the online learning features. The first one is face-to-face versus online conversation. We need to have safe environment, and sometimes online conversation feel safer to say something about the other profession or the other person directly compared to face-to-face, even though it's better to be done face-to-face. On the other hand, a negative impact in communicability online can be turned into a reflection to the importance of face-to-face interaction in interprofessional collaboration. So this need the skills of the tutor or the facilitator to take the point that we have difficulties in communicating online. The facilitator need to have the skills to take that point and make it into one of the summary that students can learn. And also consider most used platform. What most used platform in Indonesia? I think WhatsApp or Line group is the most used platform by students in Indonesia. However, there are many other platforms that can be used, like Discord or many other forums, like many things that the students use. Ask them. Second one is train the trainers, like Alla said and Marion said, that the trainers are the one what we have. we need to train them to fit the online learning environment. What the leadership need is to reimagine education with more online methods and enable the innovators to work. The innovators can transform the traditional face-to-face modules into an interactive online modules. So let them work and enable them to work. What are the policies needed? The leadership need to take their steps. For curriculum designers in medical education unit, usually they need to learn more about to enhance TEL adaptation. TEL is like technology enhanced learning. Technology enhanced learning adaptation. They need to learn more about it because usually TEL is not the mainstream issue in medical education or in health professional education. In health professional education, with the pandemic situation, we need to improve the technology enhanced learning. And for the tutors, we need to equip them with the online facilitating skills, and also hope for them to be able to adapt to new platforms, whatever it is that we want to use. Those are the things that are needed in succeeding moving the interprofessional education from face-to-face to online. And the last point I want to make is to involve students in designing new methods. Interprofessional education, by definition, is an experience that occurs when students from two or more professions learn about, from, and with each other. Those are the important things that need to be the core of the activities. Use new free platforms, apps, games, or whatever means necessary to achieve the IPE learning objectives. And yeah, like Marion said before, there are in Switzerland there is a group, a specialist group to support the transformation from face-to-face learning to online learning. And in those group, I heavily suggest that you involve student. Don't just make it only based on faculty, but involve student on, because they are the ones who know what they really want to do, what are the easiest way to make them to learn by online platform, which online platform to use, ask them. Okay, and last one, I want to invite especially the faculty who attend this webinar. This is the invitation for Global IPE Situation Analysis Survey. This is the link, the bit.ly and Global IPE Situational Analysis Survey. It's part of the Interprofessional.global effort to map what have been done and where, to what extent. First, please make sure to complete the survey or have the survey completed for your institution. So we actually only need one response for one institution. And second, and most importantly, please purposefully target and invite your regional academic institution to participate in the survey. So that's all from my presentation. And like the motto of IYHVS, we care, commit, and collaborate. Thank you.
Thank you very much, Dr. Daniel, for the session. Some important messages from Dr. Daniel are in order to adapt the IPE curriculum during the COVID-19 pandemic, there are several points that we should consider. For instance, we have to reconstruct the IPE learning methods by involving students. And then if there is a community visit by online, the most important things to do is the reflection from the students. Why they do that, not only just proceed the activity. And Dr. Daniel also mentioned that it is very important and even essential to have training for the teachers and tutors, and then to have the special teams for design the curriculum of IPE during COVID-19 pandemic, as well as the leadership. So I think that's the main messages from Dr. Daniel. And now it's time for question. And we have several questions posted already in the chat room. The first question is from Dr. Veronica from Universitas 11 Maret to Professor Marion. The question is about what is the learning objective for IPE, particularly for the research part in the curriculum. So please, Prof. Marion.
Sorry, now it works. The learning objective is to see that there are different preferences in using research methods in focusing on different topics. We can have the same research question, but each of the profession does have another aim with the research question. So, and our students learned about that. So it's more or less a medium to support the common understanding of the different profession-specific languages, and also to see that sometimes the research question could be the same, but the aim of the research question is another. So the stuff, statistics and qualitative methods, it's only more or less like a medium for supporting the common language understanding.
Okay, thank you, Prof. Marion. And the next question from Dr. Bulan Kakanita, that's for all speakers. How do you support the interaction and also communication and teamwork of the interprofessional students to achieve the learning outcome in this pandemic era? Please, maybe you can start, Prof. Marion, and then Dr. Daniel or Dr. Alla can add, please.
So yes, we are doing with role plays on the one hand. On the other hand, so the theories they've got in like a PowerPoint or a Moodle book or something like that. So as an original e-didactic unit, but the training is online. It's case-based. Usually, it's case-based at our place. And there's also a part with reflection and feedback from the supervisor or the teacher. But it's more or less a role play, case-based role play, mostly.
Okay.
With reflection and feedback.
Yeah. Okay.
So.
Anyone, Dr. Alla or Dr. Daniel, or adding something? Yeah.
I think similar to what Professor Marion has mentioned, we also it's very interactive. So we have the case, and there is different steps within the case. The student need to work together to make sure that they answer. We make sure all of our cases are reviewed by the interprofessional team to ensure that the different perspectives are included. Or sometimes you might not have the profession included within the table, but to make sure that we are giving a comprehensive perspective overall. Also we usually at the end of these let's say the case-based activities, or even the ones looking at the interprofessional communication role clarification, we also have reflection. So we ask the student to reflect on their experience, what have they learned from it. So usually, yes, reflection works quite well. And as I said, we try to map these to the different IPE shared competencies to make sure that, these are the main, we're not really, I don't think the focus is on the clinical knowledge or, trying to give them some complicated cases, because sometimes we may have public health students who are not very much clinically oriented. But our focus is on clarifying roles and responsibility, giving them the opportunity to learn from each other, and also, make some shared decisions together. And the facilitator within the group would be, giving feedback. So we have an orientation for the facilitators before to make sure all the facilitators are on the same line, and they will be providing regular feedback during the small group activity.
Okay, thank you. Dr. Daniel?
Yeah, I agree with Professor Marion and Alla that the important thing that I think need to be highlighted is the debriefing part. The debriefing part of the activities that we highlight whatever the situation arise in the session and what can be learned from that situation to achieve the learning objectives. So we are the facilitators need to know need to be aware of what are the situations that arise in the session that can help students to reflect that they achieve something in the learning objectives. That's one of the most important thing. I guess the other things are just like just supporting supportive factor for the online session.
Okay, thank you very much. So the next question is from Dr. Aditya from Indonesian Youth Health Professional Society. There are two questions for all speakers. The first question is, in your country that you represent right now, if we talk in professional setting, is there any professional organization involvement? For instance, hospital association or maybe student association that supervise the IPE implementation in health facility? Yeah, that's the first question, so please.
Perhaps we start in the end.
Okay, I'll start. In our country, in my country, in Indonesia, yes, we basically have the National Consortium of IPE of Indonesia that they consist of the Teaching Hospital Association and also the School of Medicine Association and the what's the word? Accreditation, the accreditation committee. One of the easiest way to ensure IP implementation in institution is by the accreditation. When the accreditation said that they need to run an IP course, then everyone will run it. So that's the easiest way. And it's not just for universities, but also for hospitals. In Indonesia, from what I know, the accreditation system for hospitals, they already have the standards for collaborative practice, at least some points of it. So yes, there are in our country. In Japan, from what I know, there are organizations that promotes IPE implementation, but by the national project, there are a national project that serve for 13 medical schools to run IPE. They're running it until now. So yes, there are some structure in the government to make it to make sure that IPE is running.
Okay, thank you. Alla, would you like to add about that?
Yeah, as I mentioned earlier, like I think, for example, within the College of Pharmacy, accreditation by the external body was a really driver for implementing IPE within the curricula. Also having as I said, we have QU Health, which is an umbrella for all the different health colleges within Qatar University. And I would say, again, this was another driver for making sure that IPE is integrated within the different health curriculum. So yeah, I would say maybe the accreditation for the different programs. So, as you know, every profession have their own accreditation, and nowadays accreditation do call for evidence of IPE within the different curricula, and having this structure for all the QU health colleges or the Qatar University health colleges to work together. I think that has been also very useful.
Okay, thank you. Marion?
Yes, so in Switzerland, it's a legal obligation to provide interprofessional education at each health profession university or school or health school, and also it's a legal obligation for each larger hospital. The small ones are more specialized, but the big ones, they have to educate interprofessional collaboration, and they have to implement some projects which are really related to interprofessional collaboration. The controlling is also an official accreditation process, so the government is looking onto that, especially at the universities. Yeah, and in the hospitals there are some located networks who are looking onto the implementation process, and also the Federal Office of Public Health is controlling the process.
Okay, so this is the next question. This is very important question. How to supervise the implementation of IPE during the pandemic? Daniel, would you like to start with that?
I think it's not necessary to supervise the implementation of each individual institution, whether they're running IP or not. But it's their moral obligation to keep what they said they're doing, that they're doing IPE in certain extent in face-to-face, and they have to move it to online or whatever methods available during pandemics. So I don't think it's one of the duty of an independent body that everyone still need to run IPE. That's what I think.
Okay, yeah, Dr. Alla?
Yes, I think having a unit, a center, a structure, I think that's very important to make sure that IPE is followed within every university or every college, because that would be their main roles and responsibility to oversee the integration and implementation. So having the champions, having the center, having a structured unit, I think really helps, whether it's within the pandemic or out with the pandemic, because I know for many, they had the challenges of trying to deal with their own professions and trying to achieve the outcome that IPE became secondary, unfortunately. But I think with having a structure, a unit, it really makes things, makes the implementation and overseeing the process easier.
Mm-hmm. Prof. Marion?
Yeah, I agree to both, or with both. For us, it's not so difficult, because at our university, I only can speak about our my university. IPE is the basic for all. So the first planned thing is IPE, and then the profession-specific programs will top on, and that's really a big advantage. But this is a result of the strongness of our unit. So we are existing now 15 years, and we have a strong impact on the education on our university. So, but in the rest, I think the supervision is I think we do a lot of online counseling. So also, especially if some institutions are implementing IPE programs at the moment, and they are physically running the programs or the activities, and the supervision is more or less online counseling. So,
Okay.
but IPE gets a lot of more impact now for doing it, and the benefits are more visible through pandemic situation, I think.
Okay. Yeah, the next question, I think it's also interesting about the motivation of students. What do you think about that? How we can improve the motivation of the student for the online learning for IPE? Dr. Alla, would you like to start?
Yes, this is a very interesting and an important question. And to be honest, I think it's motivation for both the students and the facilitators and the faculty members as well. I think, we've been seeing, a number of students or, students in general suffering from, the Zoom fatigue. Is, that they are online from 9 till 3 and it's continuous. And I think this is really causing a strain. So the student might be, they're wanting to engage and they are trying to engage, but when it's a long day, it's not just once every week or it's not just once during the day, but they are expected to be engaging, throughout the day and on the screen. I think this is really a challenge. In addition, I think, many students, they don't open their cameras and they don't, they don't like to expose, maybe they feel they're exposing their home environment. So they prefer to have their camera closed. And I think this affects the engagement of the student. Others may have internet connection. So, this is also another factor. Personally, I think one of the things I try is to try to ask, asking questions, maybe pinpointing to student, oh, what do you think? So, the student try to be engaged, but it's really not an easy thing to do. And I think, we thought this is going to be just a couple of months, but now it's a semester and we don't know this semester it's continuing for the other semester. And as I said, it's difficult for both, for the students and for the faculty alike. So unfortunately, I don't really have a golden recipe or solution to motivating students. I think everybody is trying, and I think, like I see faculty member, how much they are really putting a lot of effort, and the students are trying to absorb, much of the information and trying to be engaged. But it's this long process and the duration. I think I think the impact of it is yet to be measured.
Prof. Marion?
I agree with Alla, but so we did a big job. We all profession programs, profession-specific comments, sit on one table with the interprofessional unit, and we try to use over one day so that the e-didactic day is not so long with the synchronous educational part. So we try to find out how we can mix with a lot of different e-didactic methods or modes for make it interesting. And this was the process where we include the students very deeply. So I think 2 or 4 lessons synchronous, that's okay, but not 8 lessons or 10 lessons, 10 hours per day they have at our place. So we try to make a really mix, and this was a second week, sleepless week for all the involved persons. But I think I realized that if you try to simplify all the stuff, it's also one way to get the students motivated, and another way I especially tried in the research pathway. We have I let them do their own Wikipedia wikis or something like that. So they are very integrated in preparing the teaching stuff. So and present the teaching stuff more than before.
Just wanted to add,
Yeah.
just wanted to add to Dr. Marion, like for example, our IPE usually activities are usually 3 hours, but then we felt, for online, we really need to simplify this. So, we had to revise our content, and at the end of the day, I think we just wanted to make sure that students are achieving the learning outcome from this event. And taking into consideration that they are not there face to face, we did reduce the timing. So I think, yes, Dr. Marion, simplifying this is very important.
Dr. Daniel?
I think this is one of the classic problem in Indonesia, and I've read one of the feedback from one institution in Java that IPE activities are boring. Those are the feedback that we usually heard from students, and they becoming lacking of motivation in joining. And the following year, when the juniors heard about it, they start joining the course with the wrong side of thinking, with the wrong approach of thinking. So I would like to start IPE session with why we are doing this in the first place. So make sure the students understand why IPE and IPCP is needed in the whole human resources for health issues. Why we're doing this for the patient? What are the outcomes that we want them to achieve? Not just because we want them to go to the homes we want them to go to the communities and just do whatever they need to do there and then come back to report. That's not the point. The point is what are they need to learn and achieve, what the learning objectives that we want them to achieve. That's all I think.
Thank you. Wow, I think the time is flies. So we are coming to the end of the webinar. So before we close the webinar, I would like to have all speakers to select the 3 most important words that can represent your message. So I can start with Prof. Marion.
Okay, I have to think about that. Going for IPE and simplifying all the stuff and being motivated as a teacher, as a student.
Thank you. Dr. Alla.
I would say it's challenging, but it's really worthwhile it. I think the benefit, if we look at the overall picture, what is, why are we doing this? And, to maintain this motivation is really crucial. And it's a continuous learning process. I think, even if we do it, every time we're doing it with different student, different facilitator. So we're always, we continue learning to try to improve what we do.
Thank you. Dr. Daniel.
Yeah, for me it's 3: adapt, improvise, and involve the students. Adapt is like we need to adapt to whatever obstacles come our way, and this time is one big obstacle in the form of pandemic. And if we need to move to online learning, we need to adapt to online learning. That's what the facilitators need to do. Improvise is like we know that interprofessional values can be achieved by many methods. So use whatever, like online team building. Online team building has so many methods on how do they improve communication, how do they work their roles and responsibilities. And yeah, we can learn from whatever sources out there and adapt it and improvise it to be implemented in our course. And the third one, always involve the students, because they are the customer, if I would say. They know what their best for them, and they will have the voice to help guide us what needs to be done and what don't need to be, what doesn't need to be done.
Thank you very much. Thank you very much. We had a very interesting dialogues during this webinar this afternoon. So thank you very much for all speakers, Prof. Marion, Dr. Alla, and Dr. Daniel, for your participation in this webinar. We hope that this is not the first and the last webinar that we can help. We can continue collaborate with all of you for other activities, other events that we can somehow consider it during this COVID-19 pandemic. Thank you very much, and I close the session and give back the panel to the organizing committee. Thank you very much.
Thank you.
Thank you,
Marion, Daniel, and Alla. Yeah. Okay, so the organizing committee also give appreciation to all the speakers. We have certificates, virtual certificate to be provided for all speakers as well as for the attendee in this webinar. Thank you.
Indonesia kasih, tenang